lecture of health record management. We are going to be discussing electronic health records. Now we enter in the actual topic that we need to understand. Remember, we covered already paper-based medical records. Now we're going to go to the electronic part. So we're going to discuss the difference between electronic medical records and electronic health records. That's two different terms. They have two different approaches, how we receive and send information or share this information with outsiders. That's basically what it is. So let's get into it. So we have here EMR, which stands for Electronic Medical Records, and EHR, which stands for Electronic Health Records. Now, remember, this is important. You will have questions about this. You need to understand what's the difference between these two. Electronic medical records, what is it? What is electronic health records? I thought it was the same. Well, it's not. The way that we share information, the way that we disclose information, meaning after we got the approval, if it is needed, otherwise to our associates, we're going to use different approaches. All depends of the type of system that we're running in our office. So some of the systems are localized. So it is just for that particular office building. But the information do not go any farther. So we can communicate this information. We can share the information from our patients that it is collected in a digital format in the computer, computerized, but only can be shared with that particular building, organization. It does not leave those institutions. We cannot send the information to another office outside our building when we have our office, our outpatient clinic, or the clinic by itself, the medical office. So that's basically what we're going to discuss here. So EMR, this is how we know it, and it's a lot easier. Instead of saying electronic medical records, we're going to say EMR. And then instead of saying electronic health records, we're going to say EHR. That's basically what it is. So if we learn about one, we know the other one is a little bit different. It's the opposite. So EMRs. So EMRs collects, stores, and shares the information from the patient within that particular building, as I said before. It is only limited to that particular practice. Let me give you an example. A doctor's office. A doctor's office can have an EMR. A hospital can have an EMR. A nursing home can have an EMR. But what is the problem? Well, the problem is that if I need to share the information with a referring physician, with the diagnostic centers like radiology, or with an external laboratory, we're not going to be able to send that information over there. So we have to use a different means like emails, mail, regular mail through the post office, or to UPS or other, carriers that we use. So that's a different issue. So we always use that information within that particular building. So let's say that a hospital is using EMR. they can only share the information from the patient with the people that has access within that building. All the departments in that building will have connectivity to the medical records, but they cannot connect with other hospitals outside this building. That is basically what it is. That's electronic medical records. So electronic medical records should not have access to the patient's portal. Why? Because nothing outside the building can be accessed, can be shared, can be transferred via these applications. That is the drawback of electronic medical records. This was the first part of medical records that was brought to the industry. But then they found this glitch, this bottleneck, which is, hey, we need to transfer information, share information with other people who is in the care of the patient. Now, what are we going to do? Our patient is being seen in a hospital, in a clinic, but it's outside the doctor's office. Therefore, an EMR is not going to be able to send information to that clinic via internet, directly from the system to the system of the referring physician or the referred physician or the hospital or the emergency. We cannot send it. So by the time that we send this information, has to be faxed, has to be emailed, has to be through the regular mail. So when is that information going to reach its destination? Now, if we have electronic health records, on the other hand, it can be used for both internally within that particular practice, but also can be used to share the information outside the building to anywhere in the world. As long as we have a connection, internet, we are going to be able to share this information. Can you imagine? I render services to my patients. Now I need to bill the insurance company. Now I have to use other means to deliver this information because I'm not going to be able to send it directly from my system or from the systems that we use in our office to the insurance company. So that's going to take time because we're using other means to do this. So that's not good. And if we order, let's say, for instance, X-rays, CAT scans from an independent imaging center, now we have to wait until they send that information through mail or other means because we're not going to be able to connect that office, that radiology department with our system in our office. So you see the difference between EMR and EHR. So now most of the offices are using EHR. It's just that EHR requires a different equipment. It is more expensive. And when it comes to money, doctors' offices, they are not large corporations. So for that reason, usually they don't want to have EHR. But things have changed lately with the, changes, development of technology. Things have changed dramatically. Now, this is not the same. These applications, these software applications that were sold back in the days, like we started electronic medical records in the 2000s. That's what, 2002, 2003, 2005, something like that. I was there when that started. Well, it has evolved a lot. At that time, we have EMR. But now we have different applications, other companies that are, manufacturing different softwares, more advanced softwares. Now we can have the service without having all the equipment that they need. Because back in the days, you have to buy all this equipment. You have to have a computer room right there and a server and everything else. And we have to have, computer programmer. We have to have technicians, electronic technicians in our office. Well, a doctor's office is not going to have money to pay for all that. A hospital, maybe. Now we can get these electronic health records just like we pay internet services. So we can pay monthly. So most of the medical providers are, allow and have, the opportunity to get these services because it's the best services out there for, sharing these patients' information with other providers. So that's basically what it is. So let's say, one of my patients, I refer them to a medical doctor. The medical doctor needs some information because the patient is already being seen within this particular doctor. Now they call me or they send me a message says, oh, can you please send me information of this particular lab, this particular procedure, or I need to know this particular information about patient's finances, how the patient is going to pay. We need to make sure that we have, the insurance from the patient. Well, through the internet, through these particular applications, particularly EHR, we're going to be able to send that information immediately. Other than that, the medical doctor over there had to stop evaluating the patient until they receive the information. So that's not, a good thing for the medical provider, neither for the patient. Because there's going to be some some gaps right there. Maybe the referred physician is going to cancel that appointment for that day until they get the information so they can, do the pertaining evaluations to the patient and render the appropriate services. Because without the information, remember, if I don't have the information from the patient about history or whatever is needed to do procedure, I cannot do anything. So we have to wait. So that's a waste of time, money. The patient is not going to be happy. The condition of the patient might worsen. So a lot of things involved with this way of sharing information from our office. Again, we know already what the medical records contain. So it's not what is include what it is entered in the patient's files. It is how we share this information with others. That's basically what is the difference between EMR versus EHR. Remember, EMR is only used or limited to the particular practice. We cannot share the information on the outside. So the medical doctor can use the electronic medical records. The nurse can use the electronic medical records at the same time. Billing department can use, if the billing department is within that office, within that facility, that medical clinic, they can use it. The front desk can use it to make appointments. But we cannot access these from the outside. It's only internally. So lots of limitations, right? Whereas the EHR, we can use it internally, but we can also share information with other organizations outside our location. So remember, that is the difference. So if I'm going to be sharing information with an outside organization, I must have EHR. That's the only way. Other than that, we have to use other means to send that information, but it's not going to be fast. And probably, it's going to cause some risk for the patient. And, we're going to put the medical provider, in a very tough situation, because if things are not done fast enough, the patient has a complication, then the medical providers probably are going to be held liable, responsible for anything that was done or not done, due to the fact that you did not have the information on time. So that's basically what EMR and EHR are. So you know the difference between those two because you will be asked. So which one would you prefer to have in your office? EHR, because it's a complete software application that allow us to distribute all the information or to share all the information from our organization, but also share this information with other computers, other systems outside our facility, outside our clinic, our hospital, our building. Remember, something that goes beyond the building, you cannot share that information. That's EMR. And we know what we're going to share in all the patient's information, whatever is needed. Treatments, medications, procedures. Again, the financials. We're talking about the financials when it comes to insurance, what the patient needs to pay, what the patient has to pay, what the patient has paid. So that's basically what it means. So here I have a little more detailed information about EHR, remember? So electronic health records. So all the information that we have from the patient, whether from the past, currently, maybe something that we need for the future, we are going to have that information from our patients because we plan things ahead for our patients. We have procedures, treatments that are going to be done in the near future because patients have certain conditions, some chronic conditions, and we need to make sure that they receive all the care that they need. So whether it's electronic medical records or electronic health records, we use the same purpose, which is capture the information, meaning we're going to enter all the information from the patient, from other entities that are related to the care of the patient, like the pharmacy for medications, radiology, the OR if the patient has a surgical procedure, in all these specialties when we refer our patients. Every single condition the patient have had or is currently having, we're going to have it here. We're going to store it. And we're going to be able to retrieve it. We're going to be able to share this information. We're going to be able to manipulate this information. We can move things around. We can add flow charts. We can add a lot of stuff. We can add pictures, videos about the patient, procedures. Something done in paper, we're not allowed to do. There is no way we can add right there a video to the file. No, here we can add a video, pictures, flow charts, growth charts for the little babies. We can add a lot of stuff. So most of the information from our patients are going to be there. And not only that, we can share that information using internet. We can transfer that information. We can share that. Yesterday, other offices that are going to receive our files being compatible, having these interoperability systems. This came out like around 2005, 2000, something like that. Now, because, it has the time that, the same, like they were trying it first. They had pilots. And our hospital used one of the first pilots of electronic medical records. Totally different than the ones we have now. Back in the days, all these forms, they were blank. We have to fill in everything. So can you imagine? We have to type every information. Now we have templates. Now we just check. Patient is complaining about fever. Okay, fever. For how long? This many days. You don't have to type anything. Rarely you have to type something. Only if all these menu, nomenclature doesn't have, then we have to add something else. But it's very, very seldom that we're gonna add stuff. Then we're gonna order procedures. Right there they are. I don't have to type. Bloods. What type of bloods I'm gonna order? So I'm just gonna go click, 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 select, because every single test evaluation is gonna be within the system. Because these software applications for electronic health records or electronic medical records, they are done, they are built, that are customized to the patient's practice, to the patient, to the medical doctor's practice or specialty. If I'm a pediatrician, I'm going to have a software application that applies for pediatric patients. So everything is going to be related to pediatric patients. If I have, all the population, if I'm a family practice, it's going to have every single thing from newborns to the elderly. If I'm a GYN doctor, then I'm going to have everything related to women. If I'm a psychiatrist, the same, all mental conditions, but it's going to be tailored. It's going to be customized for them. It's not that we're going to have a medical records that is going to have out everything. I'm not using that information. Why should I have it in my system? So that's basically what it is. Think about this. Think about you are registered for this program. Well, they're going to have some requirements. They're going to tell you what classes you're going to receive versus if you sign up for billing and coding, surgical tech, nursing. Each one has their own menu, their own requirements, their own length of studies, different certificates or license. So the same goes with this electronic or medical record or electronic records. So the difference between this is that you cannot share the information to the outside with the electronic medical records, but it just work fine in the office. So the disadvantage is that if you cannot share this information with other computers in other facilities, if we need to share this information, that is an issue, but everything else is the same. Nothing changed because all the information is going to be computerized. It's going to be digital. So that's something that we need to understand. So probably now, if you enter to work, they're going to have electronic health records. You're going to find out. Again, now the medical doctors, if they have a small practice, they don't have to spend too much money buying all this equipment. Remember that at the beginning, when we first started, only hospitals were able to afford these. Medical doctors didn't have the chance because that was very expensive. When I'm talking about very expensive, it was millions of dollars that you had to spend with all the equipment. And the trained personnel that is going to be working on that has to be computer people. You have to have a programmer, technicians. So that is not cheap. Plus all this fancy equipment. Nowadays, we don't need that. Now they have electronic medical records, just like we use in this application right now. You just download a software application, you create your own account, that's it. Now we have it. Now we can transfer information. Now I can send you all these files through this particular application and receive in the same fashion. So things have changed. Things are not like used to be. When we started, it was very hard. Actually, the hospital quit electronic medical records because there were many medical doctors that they were not used to typing anything. So we have a computer, we have a there was not something that looks like laptops, but they weren't laptops. So we just entering information there. Then we got a voice recognition system. So we were talking and then it was typing. But that creates a lot of problems, particularly because different accents from different providers. So things were not going well. So then came out with these more advanced systems, but that took some years. So that's basically what it is. So the way that we are having these electronic medical records or electronic records is very advanced. So you're gonna have no problems, getting into this new technology when you open, the files of the patient and you add the information that you have collected or that you were asked to, review. So that's basically what it is. So the patient comes in, you're just gonna verify that the patient has the same health insurance. The patient changes his or her address, you're gonna be able to add it. You're gonna go there where it's the menu and you put edit personal information. Now you're gonna add. Remember that the information that we have on files is not deleted. You're gonna add more information and this is gonna show as the new information. But the old information is gonna be there, just in case. So again, it is very, very easy. It's like you entering your Facebook, your Instagram account. Just as easy as that. Your phone is the same. You need to call someone. Well, you go to the contacts, right? And then you type on the search window the name of the person that you're going to call. Because if you have a lot of people, you don't want to be, kind of scrolling down for half an hour. So you're just going to type the patient's name or the patient's medical record, and that's it. The information is going to pop up, and then you're going to go to the section where you need to add or you need to review some information. Very, very simple. Believe me, it's very simple. You just need someone who walk you through once, and you're going to be able to do it. Remember, they're going to assign you an account. So you're going to have a new account. This is not something that you're going to select. They are going to give you the account. They're going to create the password. This is not something that you're going to change. Oh, I'm going to change my own password. That's not how it works. They're going to assign you an account and a passcode, a login ID. You don't have to create anything. They're just going to give it to you. So this is your login and this is your passcode. Keep it private. Don't share this with anyone. That's it. You know already that you shouldn't be doing it. Now the software application is there on the screen. If you need to get inside, just enter your information on the login windows. That's it. That is it. It's not like you're going to go search somewhere Where is the application? How do I know? What is the application? Where do I find it? It's not like we have a desktop right there with a bunch of files over there and I don't know which one to open. No, it's going to be very obvious. It is there. Sometimes it's open. It's just that you don't see anything because you have to do your own login. You're not going to be able to enter somebody else's. That's it. Very simple. Again, we have so much information and these systems have lots of memory. Remember that even though if, we just have the system, the computer, you don't know what other storages had been purchased from your office. So this information will automatically be saved somewhere. So now we have to, we don't even have to bother like, oh, I have to back up the files every single day before we close the office. Unless this office don't have enough space to store all these files. Remember, we have now the cloud. And the cloud, the only thing you have to do is just pay. You pay the services. You pay for the amount of space that you need there, according to the size of your office, how much information you want to store. So that's basically what it is. So it is important for us to make sure that we just not storing stuff, but we are going to be able to retrieve this information, to edit information, to add information, to make corrections, to retrieve any information that we need to have. So people who were seeing like back in the 2000s, 2006, maybe 2010, but people really start getting into these electronic medical records. Now you can go back to them because at that time, electronic medical records were created, particularly hospitals. So then you can go back to that date and then retrieve the information. All that information is saved just with a click of, one of the keys. So that's basically what it is. The benefits are endless when we use electronic data. We're just going to place it as electronic data because we discuss electronic medical records, electronic health records. So I don't want to confuse you. We're just going to say electronic data, whether they are using electronic medical records or electronic health records, is electronically saved, stored, entered. So there are a lot of things that we can do with this information. Of course, because this is a legal document, we have to make sure that we follow HIPAA regulations. HIPAA, privacy, confidentiality, and security. Now remember, when we enter into this electronic data, we're going to talk about security. For paper, we're not talking about security. Why? Because the files are right there in your office. They are physical. Someone from the outside is not going to hack. It's not going to throw a virus right there to destroy the information. It might be a fire, yeah, but that's a different type of security. Then we use backup files. If something happened to this medical information, well, what backup information is you're going to get if you have fire? You're going to lose all your files. But in electronic or digital form, it's going to be a lot easier to control. But it's also going to be not that it's going to be a very high risk for, losing any security, but yeah, someone can try to enter, and damage the files, can send a virus. That's why it shouldn't be opening anything else in your computer that is not related to that particular medical software that we use. Because if you start, if you have access to Google, some of the computers don't even have any access to any of these browsers. So you're not going to be able to enter. But some of the computers, they do. Because sometimes you have to search certain things, certain medical doctors, because you're going to give the patient a referral, and the patient referral needs to be based on the patient's medical insurance. So we have to go there and enter the medical insurance for the patient, look at the directory, whose doctors are taking or are registered with this particular insurance, so you can select one of them. So those are the cases where usually you should be having access to it. But that is for the purpose of assisting the patient, not because you're going to go and open Google and go check YouTube videos or anything like that, or go Amazon or any other website to do your own business. That's not how it works. So again, remember PHI, protected health information. We have to protect the information for the patient. Remember, this is kind of, repeating most of the information, but that's how the books are tailored. That's how the books are customized. So the students can kind of see this information over and over and over, and they get the chance to remember the information. Okay, so the question is, why are electronic health records important? Well, I already mentioned it. Since we collect all the information in this system in a digital format, is everything that pertains, relates to the patient, plus more, whatever the medical wants to add there. So that's basically what it is. So again, what is the purpose? To improve, to maintain balance with the patient's health. That's one of the most important things. So if we have all the information from our patients, all the sources that we need, and we are able to, share these patients' information with all these associates, healthcare services, well, we're going to render a quality of care to our patients, because we are using all the options possible to make sure that the patient receives the care that they need, the care that they deserve. Now, this information is going to be kept safe in the system. Stealing the patient's information is going to be very difficult. It will be very difficult to find someone who's trying to steal the patient's information. So nobody wants to know what the patient actually had, what conditions they have. If someone wants to steal the information, it's going to be the demographics. It's going to be the patient's name, social security number, day of birth, or certain illegal things. That's a different issue, but that doesn't happen very often. Still, we need to keep the patient's protected health information needs to be secure, needs to be private, needs to be kept confidential. So that's basically what it is. But remember, the most important thing about health records or electronic records is that we can share this information with other entities, organizations, or people that are under the care of this patient. So basically what it is. or who are rendering care to this patient. That's one of the major differences between electronic medical records and electronic health records. So if I'm going to transfer information from my office to another office, I have to have electronic health records. Remember, electronic medical records is just for that particular location. That's not allowed to send information anywhere else. It's just within the office. Very limited. Electronic health records, I can use it for another country. I can be on vacation in Hawaii, Dubai, I don't know, anywhere in the world, Italy. And I can have access to the patient medical records from there. But if I have electronic medical records, I'm not going to be able to do it, even though if I'm here in the city, from my home, from another institution. The only time that I have access is if I'm going there to that particular institution where that electronic medical records was established. See, the difference between all this is a lot. Huge. It is just the way that we share this information. That is the key. So we prefer to have electronic health records versus electronic medical records. See, for me right now, I'm making money from home. I don't have to go to the school. If it is cold outside, traffic, I'm saving all this trouble because I'm giving my classes from home. So that is like electronic health records. But if I have to go to the school and it's the only place, that place, I have to go work directly there. Then that will be electronic medical records because I'm going to be in that location. And only in that location I can give my classes. If I'm outside that classroom or that particular building, I'm not going to be able to do anything. See the advantage of technology and the internet? A lot of things you can do. But we have to keep all these regulations, particularly HIPAA regulations. So don't forget that HIPAA plays an important role protecting the patient's information. So it reads here 8 core functions of the electronic health records, EHR. Health information and data. Remember, health information is what the patient gave to us. That's health information. Data is when we make this information, we enter this information and make it digital. So we keep records of what the patient complaints was, what the patient's diagnoses were or are, medications the patient taking, all the procedures, all the tests, any information that we collect from different providers that are taking care of this patient, information, and is converted into data. And what we share is the data. So remember, data is something that is printed. It is somewhere. Information is what is being collected and then transferred to data. So that's basically what it is. I got some information from one of my students. Now I record that information. Now it's called data. Because it can be from a long time ago, can be from now, from any time, but I can go back and review it. So that's basically what it is. Sometimes we use these terms interchangeable, but it's not. correct all the time. So Will says, oh, I read some information that I received. Well, you read some data. You got some information from through the letter. But the letter itself is called data. So that's basically what it is. So we have data in the computer, but that data is through, it is collected and is entered, it's typed, because the data also means pictures, means all these X-rays, CAT scans, MRIs, images, digital images, test results, diagnosis, all that is considered data, not information. It was collected for someone in different approaches. But we cannot say, okay, we have the patient this. Yeah, we usually do. But again, it's the patient's data. Results management. Now, when we talk about result management, is what is the advantage of keeping all these different types of data systems, how we maintain these medical records, how do we store these medical records in these different sections in the system. So that's basically what it is. So that's how we manage this, not only the results of the labs or anything that we order, but the results that we have by keeping this type of systems, which is the health information technology management. The order of management. Remember, order means what we order, how we go about, all these orders that we place. See, an order that I give to the pharmacy to dispense certain medications to my patients, the orders that I gave to the nurse to administer these medications or to do this type of, procedure, like cleaning the wound, doing any procedures that needs to be done. So everything that has to do with the orders that someone has given to someone else, all that information is going to be recorded as the data. Now we can store that information and we can retrieve it when we need it. Manipulation also means that, we can send this information to someone else. We can disclose this information. We can share this information depending on what is the needs of the patient. That is basically what manipulation also means. Now we have this type of electronic files that we're going to send them through electronic means, online, using internet, using all these special equipments, connectivity. Remember how we connected, through which systems. Again, there are a lot of stuff that, needs to be accomplished in order for us to have, a complete, electronic records. It is not just whatever we collect from the patient. It is how we are going to transmit this information, use this information to connect with other providers for the good of the patient. Patient support. Of course, we talked about yesterday, the patient's portal. So patient is going to receive, access, it's going to have access to some of the information that there is within the medical records. And from their homes, they have an electronic device, a computer, a cellular phone. They can just open an account, or we help you to open an account so you can have access. You can add information. Remember, you are the one who have the phone number. You are the one who is moving from this location to another location. You are the one who changes any of your demographics information. Now you are single. Well, not single. You are divorced. We are separated. You are widowed. You are this or that. Well, we're going to have that information there because you're going to have access to these demographics, and you can, add or remove certain things. So that's basically what it is. There are certain things that you cannot remove, so you're not going to have access to it, but you're going to have the access to add this information as an addendum. So you're just going to change your address because you moved from your previous place. Your number, you have changed. Your email. Oh, I lost my password. I don't know what my password. I'm just going to create another email. Whatever the case may be. But the patient is going to have access to their information. And they can see it anytime, as long as they have connectivity, as long as they have this internet service. They're going to be able to, enter their accounts and add anything that they need to add. They can do changes, or they can just suggest that there is a change. So you enter all this information, and we, the medical professionals, can do the changes. But we have the information right there. The patient enters the scheduling systems, they can make an appointment. Now we have to confirm that appointment. It is not the same as the patient needs to go to the office or not even phone us. There is no need for that. Administrative processes and reporting, of course. This electronic health records is not just for the clinical aspects of the care of our patients, also the administrative. Remember, medical offices, whether it's hospital, whether it's a doctor's office, small, large, medium size, whatever the case may be, we use these same settings. The administrative part, the clinical part. So most of the things that we were talking about were the clinical aspects of the patient's care. Now, what about the administrative? Remember, change the patient information is administrative, making appointments is administrative, dealing with the patient's medical insurance is administrative, all the financials, administrative, getting all these forms, letters, sending you a letter because you did not show up, or a letter of termination of services, or a referral. A referral is administrative. A blood test, this is administrative. Now, when we give you the results, that changes, now it's clinical. All the registration process and all these forms, everything is administrative. All these consent forms, these are administrative tasks. So again, it's a lot of stuff that we have, but we need to make sure that we understand what is the part that concerns administrative tasks, what are the clinical tasks, what is medical, what is administrative. Of course, there are more. We're not going to mention all of them. Reporting population health. Reporting population health. Well, the reporting and the population care, that's basically what it is. Remember that If we have a patient who was diagnosed with this particular condition, we have to report that because that might be a health concern. That's how everything started with COVID. One person started, coughing and having this, then two, then three, four, five, the many people. But then we look at the statistics. Oh no, that's not only in New York. That is also happening in Florida. That's also happening in Chicago. That's also, or Illinois. That's also happening in Canada. That's also happening in China. Well, that's how we know, because we report conditions. That's how we know what's going on. That's how we know how to prepare ourselves to prevent the condition, to isolate these patients that are causing, the transmission of these infections, or just, for the record, to know how many people have been diagnosed with these medical conditions. That even though if they are not communicable diseases, still they're going to be a threat to to the society, to the people, because it's affecting more people. There are certain conditions that are very common in this country. Others are not. But there are certain conditions that are not common here in our country, but in other countries are very common. There are certain conditions that we don't have them anymore here in this country, but in other countries still prevails. But how do we know that? Because we report all these conditions, because we have statistics. Remember, we're going to report them to the CDC, the Centers for Control Disease. That's basically what it is. And prevention. That's what we do. We're not reporting this to the police or to the armed forces. No. So this is to the health department. And that's going to be shared with everyone when we add all our statistics to the World Health Organization. So that's basically how it works. So the medical providers diagnose the patient. This information is going to go to the CDC, and from the CDC is going to go to the WHO, the World Health Organization. Now everybody knows what's going on in our entire world. That's what we have statistics. That's how we know how many patients have this condition, this condition, this condition, and how many of them. What's the age of this patient when they develop the condition? What are the treatments? What are the best treatments for these patients that we call the gold standards? That is a different issue. Other than that, we wouldn't know much. And we learn from these conditions and for these treatments. So we use them as a precedent. So if I have a patient who has diabetes and is this age, this weight, this gender, this race, well, I'm going to treat them in the same way. Because that's how it works. Because I know that I have a reference already, a precedent, or files, documentation about treating this particular type of population. It's not that we just medical doctors, oh, no, I'm just going to prescribe whatever I feel like I want to do. No, that's not how it works. We have already a database when we have all these medications and the dosages, depending of, the size of the person, the age of the person, the gender of the person, other medical conditions. So it's a bunch of stuff. But the point here is that we need all this data. And if we have them available, and if it is electronic or digital, it's going to be a lot easier because we just enter certain directories, certain websites that we are authorized to use, and we can get lots of information about this. So that's how it works. That's how we know how to treat the patient. We know what signs, what symptoms, what findings we're going to find, what tests we order. This is not something that the medical doctors just decide out of the blue. This is standard procedures. Standard procedures is what other medical providers uses to determine what is the best management approach to diagnose or to treat this particular patient when they have this particular condition. That is the standard. This is not what I feel I want to do. Oh, you know what? This patient has this. Oh, just let me go to the medications, directory and says, yeah, this medication is good for hypertension. I'm going to give it to the patient. No, I have to see more than that. But if we have it right here in the system, we have all these data, I'm going to be able to get the most appropriate management for my patient. So that's basically how it works. It's very important that we understand all this. Now, it doesn't pertain to you at this moment, but because we are talking about electronic medical records or electronic health records, you need to understand how these systems work, how they benefit not only the patient, but also the institution that is dealing with these patients. Think about this. If you have much of the information about someone, you know how to address this person. But if you have no clue who this person is, chances are, that you're going to be having some issues with this person. It is best when you know about this person versus when you do not know. So in the medical setting, it's the same. That's why we have records away from the medical about criminal people or people who have committed crimes. Well, that's why we have some type of records. And you search about them, it says, oh, this is a criminal. They have killed many people. So isn't it good to know about them versus not knowing and just encountering these people and put ourselves at the risk? Well, it's better to know information. But when we're working in these particular settings, we need to know what exactly we're dealing with, because this might be a life or death situation. So we need to assist our patients. We need to make sure that we know what we're doing. There are some criteria that we need to use when we are, collecting information in a digital format or computerized software applications. So one of the most important things, and we talk this when we talk about paper-based medical records, capture data at the point of care. Yes, I have my system right here. So at the time that I'm talking to you, I'm evaluating and entering that information. We call capture, because we get information from you. We asking the questions and you're responding back to those questions in one way or another. And we're going to capture that data directly in our place where we are working. Now, remember, we can integrate data from multiple sources. That can be done with paper. That's not the difference. It's not the difference about how we capture the data, how we use it, but how we can get assistance from other sources that otherwise with paper-based, we're not going to be able to have it. Yes, I can capture the information and just document it by, writing the forms, completing those progress notes or any other type of form needed. Am I going to be able to integrate these with other sources? Sometimes it's going to be a little harsh. Yes, you can add certain things, but once again, in paper, you cannot add sound, you cannot add videos, you cannot add pictures. There's no way that you can do that. Well, pictures, yes, in a way, but I'm talking about digital pictures. And all this information is going to lend up, to provide decision support. Remember, we need all this information to make sure that we have the right diagnosis, the correct diagnosis, I might say. Because all this information is going to give us all the tools to make decisions. But if we don't have all the information that we need, that's not going to be good. That's not going to be helping us. And remember, that put at risk the patient health-wise, and it's going to put us at the risk for omitting or neglecting to do something. So that's basically what it is. So we need to have this information. One way or another, whether it's paper, whether it's digital, but we need to have it. But digital information is more, it's like, less errors. Because remember, when we write down information about the patient, it is a little difficult to read the handwriting. Illegibility. But if it is typed, that's going to be a lot different. But if we don't have the information, or we don't have the sources when we can get information, well, we're just not going to have everything. It's going to be a little difficult to make decisions. So the integration within all this information from different sources is going to help us a lot. Now, health and safety concerns. So just like anything else, there is always going to be a risk where, we might, disclose the information, sometimes unintentionally, but we have all the, safety regulations within this digital format to protect and reduce, not only to disclose or to violate the privacy of this information, but also for errors. Remember, materials that are written or handwritten are very difficult to read. So there are many errors that can be made because many medical terms, sounds, and they are written, the grammar is very alike. So we just see one word, one ending of the word, but says, oh, this is what it's trying to say, but actually it's not. So a lot of errors can be made. So if we have printed, electronic data, it's going to be a lot harder because anybody can read it. It's just that the way that you interpret them is different. But then that's what you're a medical doctor. That's where you are professional in your field. You're going to be able to understand. And if you don't, then you're going to find, the right answer. You can just make decisions based on what you think it is. You got to make sure. Remember, this is not just the health of the patient that it is at stake. It's our, job, our license that is also at stake. Healthcare costs. Now, again, I mentioned it already. Electronic medical records or electronic health records are more expensive than having paper-based medical records. But one thing with the other, right? So it has all, few advantage, which is that it's cheap. But then what about sharing the information? What about interoperability? What about security? It is not much there. Yes, we're going to keep all these records from day one, past and present information. But what about the safety of these medical records? The usage, how we're going to share this information with different people at the same time. It's not going to happen. So electronic health records right now, it's not that expensive. I'm telling you, that's like paying internet services. Because now I don't have to have all this equipment in my office. I just have an application in the system, and that's it. This is like Teams, like WhatsApp, like Facebook, like Twitter, like Instagram, any of those applications, TikTok, anything. Very simple. What I'm trying to tell you is it's an application that anyone with a little knowledge can handle, can, use these applications. I don't have Facebook. I don't use Facebook. I don't use Instagram. I don't use any of these, social media applications. I don't need it. But if I have to, it's very simple. And these little kids, I've seen them, having Facebook, TikTok. They know how to handle all this. So it's not difficult. It's very self-intuitive. So very easy to manage, to open this application. So it's not a big deal. Sometimes, you have a little issues here and there, but then you do it once, twice, 3 times. Now you get the hang of it. So that's basically how it works. So it is important, that you must have electronic health records right now. Having paper-based medical records is not the way to go right now. You are falling behind in technology, probably putting at risk your patients and your licenses, your office, your finances. So not good. So everything, have changed with technology evolving. Everything have changed. Now everybody's using, well, not everybody, but let's say 95% of the population in this world, if they have access to electronic devices, they are using all these social media. As long as they have internet, they're going to be able to do it. So in our medical field, well, it should be a must. So it's going to be a lot easier to process all this information, retain this information, retrieve this information, and share this information. So that's basically what it is. So I don't recall the last time that I sent a letter by mail. I don't recall. First of all, usually I don't send no letters, but we used to do that. I used to pay with check. I have a checkbook, but that was a long time ago. Then we have all these systems, that uses directly from my bank account. I just pay my bills directly from my bank account. I remember I used to use money orders back in the days. Not anymore. Now that I'm talking about, I just remember, I just recall about it. But you see, this have happened to some of us. Not long ago, we were using all these paper, base receipts we were using for, paying bills and things like that. See, I have everything electronic. I don't want to see in my mailbox all these receipts, all bills for electricity, for gas, or for internet, or for cable. I don't want to see any of those. Or my maintenance. No, I don't want to have all this garbage in there. That's a time consuming. And they put me on risk because most of the time I just throw it right there in one of those trash cans without shredding them. And my information is there. Somebody else can put their hands on it. So I want everything electronic. So everything comes to my emails or these software applications that I have for these particular payers that I sign for. I don't receive bank statements anymore. No, I don't want it. Everything is paperless. And if I want to see something, I just go to my account and I check all the statements. That's how technology is, is being a very important advance that we have to use, because for security reasons, it's a lot better in papers. You don't want to see all these papers all around. So we don't want to see all these papers from our patients' information everywhere. They're going to be sent directly from the laboratory, sent then directly to the patient's medical record. Can you imagine that? I don't have to be sorting on the email. Oh, I'm working in the front desk. Now all these lab results are there. I have to sort them out. I have to place it in the bin for incoming mail or incoming blood results. And then I have to wait for the doctor to sign it. And then I have to file them. That is a lot. That is taking all this time that we can do other things more productively. And, we're not having the risk, security, safety risk, or losing those papers, or misplacing, or misfiling. Everything is going to be there. I don't have the responsibility of filing this anymore. I don't have the responsibility of opening, sorting out all these correspondence that comes to my office. It goes directly to the medical records from the patient. That is it. So you know how much time I'm saving right there for the safety of the patient, because we have all the information directly in the patient medical records. So the doctor doesn't have to call me and says, hey, Alberto, can you check the blood results on this patient and see if we have any, if they came on the mail. Oh, now I have to go and search through all these papers. I don't have to. The medical doctor just opens the computer, enters the patient's medical records, check, search for the patient, look the labs and says, oh, here they are. That's it. Other than that, you have a contact right there in your computer from the lab. The doctor is going to say, hey, I haven't received labs from this particular patient. Can you forward it to me? Or what's going on? That's it. And they're going to respond back to me, or they're going to just send those results to me. So I don't have to use you as a medical assistant or nurse, whoever's in the front desk. Sometimes you don't even have to, deal with the patients all the time right there, because they make their own appointments. Oh, I have an appointment. Sure, not a problem. What is your name? This and this. Okay, no problem. Yes, I have it right here on the appointment list, on the appointment schedule. Oh, please have a seat. That's it. And then instead of asking all these questions and things like that, because the patient probably updated their own information, the only thing that I have to do is asking you about your insurance. That's it. If I have to do vital signs, well, I'm going to do vital signs, but I'm not spending time asking, what's the reason of your visit? What is this? Are you taking this? Are you allergic to this? No, everything is going to be in the medical record, so I'm not going to bother. It eliminates all these, time that we have to spend with the patient. So the patient is just going there and few information is just going to be captured from there. So that's basically what it is. So it's very important. These new, applications for the health, the electronic health records. That's basically what it is. I already mentioned, other social forces that drives the medical providers to adopt the electronic health records is mobile society, mobile. So again, nowadays, who doesn't have a cellular phone? Unless you have a cellular phone, everything is done electronically. Patients are very aware of what's going on. So now we can transfer, share your information very easily. Patient adds information to the medical records, do changes. It is informed about what's going on. They know what medication they're taking. Now the patient comes to our office and everything that I discussed with the patient related to that particular visit, patient is going to have it. If I prescribe medications, patient is going to have it. So there is no excuse to come to the office and says, oh, you prescribed medication, but I don't recall what it was. Oh, I was in the office this such a day. Oh, well, it shows here. There was this day and that day. So that's basically what it is. So with these electronic health records, we're going to be able to do a lot of things. Remember, just the fact that, from directly from these devices, we can send information, receive information from our patients, including the patient. That is a huge advantage. Again, it's not about the cost anymore. It's about how flexible, how much information we collect, how we can share this information. And the results, the outcome is we're going to improve the health of our patients because we have all the information, at the touch of one of these keys on these electronic devices. So we can message the patient at any time. Patient is going to get the message. Can you mind sending the patient a letter? When are we going to receive the message? Well, we're going to wait for the letter to reach their destination. Then whether the patient read it or not, whether the patient receive it or not, that's going to be a little hassle right there. Through these mobile devices, it's going to be a lot easier. So it's just for everyone, not for the medical provider, but everybody who is involved in the patient's care, including the patient. So that's how we are going to be dealing with this. So functional benefits of electronic health records, health maintenance. Now, when we talk about health maintenance, is how we gonna approach the conditions of the patient. We diagnose the patient, we treat the patient, how we're gonna follow up through with the patient. How are we going to prevent something from becoming worse? So that's basically what it is. When we talk about health maintenance, this is one of the most important things. I'm treating you about condition. Yes, that's important. I'm following up with you to see if the medication, the treatment is working effectively or not, whether we have to do some changes. But that can be controlled through the electronic medical records because we are continually seeing all the changes. We are receiving all these test results directly in the system. The patient is taking this medication, started this day, this dose. It's getting better, it's not getting better. Well, let's do changes. And not only that, remember, we can prevent certain conditions from happening. That's why from the first day of the child's life, they receive all these immunizations. And there are some immunizations that we receive when we are adults. Let's go back to the COVID-19. After they did a bunch of studies, they came out with a vaccine for the COVID. So it's not done, it's going to help the people that already developed the COVID, but it's going to help the people who has not been exposed to the COVID. So that is the key for immunizations. Immunizations is not something that is going to cure something after starting. No, it's to prevent you from getting this condition in the first place. That's why the babies, from the moment of birth, the first day, they're going to receive the first shot, which is Hep B, hepatitis B. And then all these other immunizations at certain stages of ages of their life. They're going to get the MMR, mumps, measles, and rubella. They're going to get the polio vaccine. They're going to get this. They're going to get that. So again, this is important. And we're going to have a control. We're going to have records there that we can go and check whether we actually gave this child, this adult, this particular medication, this particular immunization. Versus, oh, no, we don't have records of this patient. So, see, I know many people that they don't have records of their immunizations. They come from different countries. They come here and yeah, they apply some immunizations over there, but they don't know what it is, particularly the older population. We didn't have electronic medical records in the past. Everything was paper. And when you move from one country to another, the last thing that you're thinking is, oh, I'm going to bring my health records. I'm going to ask for a copy of my medical records. I'm going to get my immunizations at least. Oh, what medications I'm taking here for this condition that I have. We don't keep them. The only thing that we care is moving to the other place, getting a job, and start working and supporting yourself and your family. We don't do other things. See, our health records is the last thing that we worry about it. Nowadays, we can actually get that information from other countries. See, at the school, college, university that I used to work, students came from overseas and they said, oh, I did this. Oh, I have a high school diploma. I have a license of this. I have a bachelor's degree of this. So they brought some papers, right? Some physical papers. Yeah, that's something. How do I know that these papers are actually the original? They are actually legit. Now we can use the system. I can go directly to that particular university from here and check whether this person actually graduated from that and if actually study those credentials that presented to me are real, are legit. Otherwise, it wouldn't be able. Who's going to contact another country just to find out that? No, we do it online. And that's how we do many other things. So electronic communication is not only for the medical, it is for every field, every industry. We need information from other places, we get it. Very fast. And we keep all these records so we can go and, review them. Make sure that, we are continuously, checking what's going on with the patient, because whatever happens in the past, it might be the reason why you're having something now. So again, very important. So there's always something to do. So we're going to use the patient information for almost anything that benefits the patient. Say we have a patient who it might be a potential donor. They want to be a donor of organs. Because remember, you can be donating your blood. You can be donating a kidney. How are we going to know? Because we have this documentation that is electronic and it's a lot easier. If you have a healthcare proxy of these advanced directives, is electronic is going to be there. It's not going to go anywhere. And I can request this and have access to it from anywhere. So that is the beauty of, or the benefits of electronic health records. Because if the information was collected, the information was entered, whoever requests for it, after going through all these protocols of security, privacy and confidentiality, you can get this information. Remember, you have to meet the criteria. But that's how it works. Without this, we're not going to be able to do anything. So that's basically what it is. When I came to this country, I started working in a hospital. Well, that was not my first job, but it was like my second job. When I started working in a hospital, they asked me for all these immunizations. They were going to give me all these shots, whatever was needed. Said, oh, you need this, you need this. I do have my immunizations, but I have it in paper. And I showed it to them and then said, oh, yeah, you're vaccinated for that. Oh, you didn't. Oh, but you need this. Oh, that's fine. Remember, when you start working, they're going to get, your PPD. This is for, the screening test for tuberculosis. And they're going to see whether you were vaccinated for that. So usually in the medical field, we get that. All depends on the protocols, the policies of your organization, every 6 months or every year, the latest. So all those things are going to be checked out. If you start working, they're going to ask you for your Hep B vaccination, hepatitis B. And if you don't have it, they're going to give it to you. So that's how it works. But if we have all this information in my electronic medical records, remember, it's a lot easier to retrieve this information than have papers. I have everything in paper. Oh, I brought this paper, but I don't know where I place it. Oh no, it's here in the system. I just enter your last name or your medical record numbers, and if we have it on file, we collect it. Here it is. If you present it to me and I give it to you, now you enter that information, it's going to be there available. But if it is in paper, who's going to go there and look for paper? I work in this hospital. Now, when I was medical assistant, that was like in 2000 and something. So again, you see how important it is to have all this information digitalized or computerized so we can have access to it whenever we need it. So that's basically how it works. Very important, all the benefits. So this is one of the screens from, the health maintenance pages that we care. So if the patient has any of these conditions, taking any of these medications, having any of these vaccines, everything is going to be there. And you see, everything is written. We don't add, and it's very seldom that we're going to add something, that we're going to type something. Because we know what vaccinations you need. We know if it is positive, if it's negative, if it was repeated, if it's another dose was given, when was given. Everything is going to be there as long as, if we record it, if we give it to you, and if we have information from you given to us, well, we're going to add it there. But again, there are certain vaccines that need boosters in certain period of time. If it is required, it's going to show there what day you need to, get this particular vaccine. And it's going to show in your records. So when we need it, we're just going to go there and check. Yes, has it, vaccinated, unvaccinated, vaccinated. That's how we know. Sometimes you can lie to us, says, oh, yeah, I have the COVID-19 vaccine. I have the first dose, the second dose, the third, probably the fourth. But we're going to see in your medical records, and if it doesn't show, well, Again, we have records. We have everything. This is very, very, very simple. I think that electronic medical records or electronic health records is a lot easier to manipulate them versus paper. Less of the hassle. You can read and understand everything. Because believe me, you will not be able to understand the doctor's handwriting. That's not going to be possible. Very few things you can understand. Then that means you didn't get any information. But that was the purpose back in the days, to make sure that nobody else who wasn't the doctor or the medical providers who take care of this patient to read and to see what the doctor has, what information the doctor has documented. So that was the purpose. But then we have a lot of legal issues, right? Lawsuits for malpractice. Now we have to determine, because we're going to use your medical records. And it was difficult to understand because there's another medical doctor who's going to read this. But some of the times we cannot even read what other doctor entrance or entry have done. I mean, it's just very difficult because it's illegible. Now we don't have no excuses. Whatever is typed, you can say, I don't understand it. Well, not in the medical field, not in the court law. So that's basically how it works. So more benefits of, the electronic health records. Anything that is digital, that is kept, stored in the system, it's going to be a lot easier to be retrieved, to be stored first, then to be retrieved, to be manipulated, and then to share this information. Anything. You can do the vital signs and right there from the front desk, from the medical exam room that you are in with your patient. You can just log into the computer, enter the patient's information, whatever you collect, vital signs. You check the blood pressure, you check the temperature. You're just going to enter that information on that particular patient. Now, the doctor is going to see that when he starts seeing the patient. When you bill, you're going to see what services we provide and what are the costs for those services. We're going to see it over there. And that's not you. It's not going to be the doctor. It's going to be the billing department. Then the insurance company is going to be seeing all the things that we did. They weren't there, but they can see this, and that's how they're going to reimburse us. Now we can compare the results from this day, from that day. Last time the patient came in and we draw blood, and these are the results. Now we have a new results. Let's compare what's the difference between what was last time that we saw the patient and what is the improvements the patient have now after we start the patient with medications. Remember, we don't compare labs just because we want to compare them. But it's a lot easier to compare them because you're going to place them side by side on the same screen. So I'm going to see before and after. That's kind of thing that we're going to see. Oh, how was the glucose last time? Oh, was 200. Oh, that was high. Now we have the glucose going down. And now we see the medication that we give to the patient. Now we're going to make a decision whether we have to increase the dose of the medication, add another medication, discontinue the medication, start with a new medication, order another test to see how the patient is going to be doing from now on. That's basically what it is. Because we're going to have all this information right there. It's not like I have this paper right here, I have this paper, and I have to, it's a little more troublesome. And we're going to compare. So we're going to see how the patient was before and what the changes that we have now. These are, the trends that we're going to see. This is like It was before, again, and after. What are the changes? What are the changes? There was any changes, good changes, positive, negative changes. So that's basically what it is. Now we can create, flow charts, growth charts, anything, just to make sure that there are some changes, positive changes, negative changes. I don't have to see all the written information. I just see a graphic there that is telling me, oh, wait a minute, this cholesterol is going up, no. Versus the other one was kind of steady, kind of, plateau. Now we're seeing things, oh, it's going down, it's going down. Wait a minute, I can see it. That's like, when we see the finances from the Wall Street, how, inflation, how are, the prices of this particular item or these particular services went up, went down, stay steady. So we're going to see the flow chart. We have flow charts for everything. Now, growth charts for the little babies, because we have to check the little babies, growth as, times moves up. So we need to have all that to see the changes, to see if there is something we have to do or the child is developing in a normal rate according to the age, according to, hereditary. Because if your parents are short, how we're going to expect that you're going to be tall just like another child that is the same age? It doesn't work that way. But we're going to keep all these trends and we're going to, make sure that we have all the information that we need. That's how it actually works. Alerts. This is so important. I love this part because I have to do this a lot, particularly with medications, allergies. See, when we prescribe a medication, remember that I told you a little story back in the days when I worked at emergency. I prescribed medication and it turns out that one of the components of this medication, the patient was allergic to it. It was caught by the nurse and she informed me, which I'm very grateful for that. For me, for the patient. I didn't do it because I want to. But remember, that's called, malpractice anyways. If the nurse have not caught that on time and the patient suffers, an allergic reaction to it. So whenever we have these special situations, we're going to receive alerts right there in the system. So when we prescribe medications, immediately we're going to enter certain criteria about the patient, which is not going to say, okay, I'm going to just simple. I'm going to prescribe Tylenol. Just for you, because you're very familiar with Tylenol, Motrin, Aleve, because these are over-the-counter medications for pain, fever, inflammation, and so on and so forth. So I'm going to prescribe this medication to my patient. Immediately, as soon as I add that to my patient, immediately, because I have had other medications prior, it's going to send me a message. Oh, this medication, it is, counteracting, is a contraindication, is going to affect other medication that is taken. It's going to increase their potency. It's going to increase the toxicity. This medication is going to affect the patient's kidneys. It's going to affect the patient's liver because the patient has this condition of taking other medications. So whenever this medication conflicts with another medication, can you imagine? The system is telling me. How is a paper-based medical record going to tell me any of those? I had to enter myself into the system, try to see what are the, allergic reactions, secondary effects from the medication, contraindications, and so on and so forth. I'm still might not get it because I'm not comparing them with, medical conditions and other medications that the patient something might be, off. Here in the system, as long as I have it right there recorded, it's going to tell me. And that's what it matters. Because if I'm going to be sued for malpractice, I have the system that protects me. I base my knowledge plus the medications based on these particular alerts that are received from the system. So this is really important. If the patient has an allergy and is recording the medical records, I totally forgot that the patient has an allergy. And I prescribe this medication. It says, this medication is going to be, against the patient's condition. The patient is allergic to this medication. Now, because it's going to go over every single detail about the components of the medication, not just the name, because it might be one of the components. And we don't know every single component of the medications. I'm not a pharmacist. I'm not a pharmaceutical company who created these medications. So I just have to follow certain things, certain trends, and that's how I'm going to get this done. So this is really, really, really important for us, including not only when I'm prescribing the patient a medication, also when I'm giving orders to the nurse to give medications to the patients. It's going to give me the same alerts if there is something critical there. And it's automatically. It's not that it's going to send me a message later on, 24 hours later. No, it is immediately. As soon as you select the medication, immediately a little window pops up and tell you what are the things that this system is not finding right, correct, by prescribing, selecting this particular medication. See how important it is? This is one of the best, features that this system has, particularly for the medication and drug utilization purposes. That's very, very important. So here we have a little sample about the medication. I believe it is warfarin, and it's contraindicated because the patient has this condition, and we cannot give it to it. So that basically. Now, you don't have to deal with this because you are not prescribing medications, but it's for you to tell you the benefits of electronic health records. Of course, when we have all these add-ons, all these ancillary software applications, because you have to have these, the medical records by itself does not come with this if you're not prescribing medications, if it is just for the patient's documentation. But if we're going to use this medical record for, prescribing medications and everything else, you have to have this part, because there are medical records that do not have this part. But it's not because they don't have it, it's because you didn't purchase this, because that has to be kind to, some features that are add-ons to the software application. But most of the applications, they have it because if the medical doctor prescribes medications, well, you got to have it. So that's basically what it is. Other benefits, decision support. Now, think about this. Decision support means when I'm going to make a decision to diagnose my patient, to prescribe this medication, it's going to help me because I'm going to have all the tools. When I have problems with a patient that has these particular symptoms, and some of the symptoms are very basic, meaning it happens in several conditions. How do I know which these conditions is the one that has the problem? Well, it's gonna alert me as well. It's like giving me a hint. hey, you should order this test. And if you find this particular electrolyte, this particular vitamin, high, low, patient has this or has that. So it helps me with the diagnosis. So that's basically what is important right here. All these guidelines that they have. So assessment, not only with the medication, remember what we discussed previously, but also on how I'm going to use this particular testing, um, supporting information. They're gonna suggest to do this particular test, and they're gonna tell me that when the test results comes in, if I see this or if I see that, then it's how you are going to try to narrow down this differential diagnosis. So that's basically what it is. So it's all the advantage that we have right here. So don't take it on me. This is not something that you don't have to do it, but you need to understand what are the benefits of electronic medical records. What you need to understand for this chapter is that, this information is going to be available, that you're going to be able to store this information electronically, that you're going to be able to share this information with the entries of the associates, including the patient. If you need to do something else, then you have to follow the HIPAA regulations. That's a different issue. How you can store as much information and still, you're going to be able to. You're going to be able to not to only to store this information, but to retrieve this information. To play around with this information. Remember, manipulation do not means like I'm manipulating you to do something, but in the good concept of medical data or any type of data is that you can extract parts of the information, because I don't need to send everything to the referring physician, to this particular doctor, this particular specialty, this insurance company. I don't need to. I just extract some information. I'm going to be able to do that. That's called manipulation. Remember, sometimes we say, oh, if it is in paper, well, you're going to make half, you fold the paper and you just print out the part that it needs to be faxed, or you just cover it with a blank paper on top, the information that we don't need to be copied or photocopied. Well, electronically, it has different features. You're not going to print it and then you're going to try to cover up the part that you don't want them to see. No, you can select that particular information and you can print that information, or you can directly send from the medical records that information to the target, recipient. So that's how it works. So we have a lot of information right here. So this decision support, it is very important, because we're going to have all these access to all these relevant information that we collect. And it is evidence-based information, because it's something that, has occurred. Remember that we follow things that has happened in the past and we use it as a reference. If I have a patient with diabetes, I'm going to see what other doctors have done. That's what I have, this type of medication that works. And what is the dosage? Convenient, depends of the age of the patient, the gender of the patient, the race of the patient, the weight of the patient. So all those things all together. So I'm going to get this information right here, because it's going to tell me, according to the characteristics of this patient, this is the dose that it is recommended for this patient from this age to this age, with this condition, with this stuff. So it helps me. It assists me with all that. So that's very important. Paper medical records don't do that. It's not going to tell me anything. I have to do it on my own. Go search and search independently each thing. patient's age, medication dose, route of the medication, at what time I have to give medication, what is the weight of the patient, independently, individually, I might say. So that is a different issue. Digital image data. We mentioned this before. We have the PAC. Remember this picture interactive, which can use, certain applications to send, images from the radiology department directly to our computer, not just to our computer, to the patient's medical record. And it's going to be stored right there where the images are. If it's an X-ray, it's going to go directly with X-rays are. And it's going to place it on top of all the information in a reverse chronological order. If it is a CAT scan, it's going to send it right there to the imaging reports when it says CAT scan. Right there on top on previous CAT scans. It's the latest. And not only that, that is going to send me a notice. So as soon as I have one, like send me text message, ping, oops, let's see what I get. Oh, patients, x-rays, blah, 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 done. Then I have to go there and read what the radiologist's diagnosis is, what the recommendations are. That is fast. As soon as it's done and the radiologists have read this, interpret this, they're going to send me the information. So I'm going to have that information. But again, I'm going to receive a notification, just like when you receive a text message. Immediately, if you set up your notifications, you're going to receive a notification. You have, I have a message. Let's go check. So it keep you up to date versus, we're just waiting for the mail to drop those results. And we don't know where they're going to, the results are going to come. There's no message that's going to come to me. And probably will receive it and nobody is going to read it. And nobody's going to open the envelope. Maybe they're going to misplace it. Maybe they're going to file it. And I don't know anything about this. So every single, it's not just the data. It's not just digital images, blood results, anything related to body fluids results, any evaluations, any procedures that we send the patients to do, we're going to receive the results. Digital. How good is that? So it saves us a lot of time. It saves us trouble. And we can continue with the patient's care without interruptions and probably on time. So that's how it works. Now we can add information from different applications like word processors. We have a letter from word processor. We can make it digital. We can actually, it's compatible. Not like a PDF format. No, it can come right there to our system and we can receive the format exactly as it was written. So they can be imported into our files. And, we can retrieve it, we can print it out, we can read it, we can share this information. So that's basically what it is, particularly when we do transcriptions. Remember that when the doctor is making, just learn from me. If you know it, fine. If you don't, that's fine too. You're gonna learn. When the medical doctor is doing a surgical procedure, they have the hands busy. They're not gonna be with the phone right there, taping or recording the patient. No, they have a little tape recorder. They have a headset for, the sound, and they, talk about all the procedures, everything that they are doing, because they are recording the procedure. But everything is voice that is being recorded, their voice message. Now we have systems that, instead of translating this into these applications that we can read later on, they can use also word processors. See, back in the days when the doctors did this, they have a transcriptionist, which is going to hear the message and is going to write it down, or it's going to type it. We don't need that transcription anymore. Why? Because they make a lot of mistakes and we have to pay extra for it. Now, these voice recognition machines are going to be taping, recording that information, and then we put it in the system and it's going to convert it into word processor documents directly through the system. I don't need no one to do it. I can do it myself. Or someone else that just put there, and then, this tape is going to be transcribed into word processor. So that's basically how it works. Very interesting. I use that, the voice recognition system. It didn't work much. Why? Because these systems needs to be, they need to be accustomed to your accent, and you have to be repeating things over and over until they can adjust it to understand you. So it takes too much time. It doesn't work. Then they came out with these tablets when we just write it down with it, with the pen right there on the screen, and then it converted to word processing. That was a lot easier. Why? Because this is the way that we write medical records. They're still there and they are very useful. So if someone is very bad, typist, they don't know how to type because typing is not easy. It takes a lot of time. It's a lot of information. We're not going to make mistakes, grammatical errors. So you just start writing it down. And when you write it down, the system application that these tablets has, it converts this to word processing. And then, we just add it to the patient medical record. But back in the days, we didn't have any of this, so it was a little troublesome. Now we have more stuff. Things are a lot easier to work with. So this is for you to understand the fundamentals, the basics, how electronic medical records works, how beneficial they are to our patients, to our institution. So that's basically what I'm trying to tell you. Okay, so let's take a break because I just received a message. Hey, Professor Hoyer, you're going over time. This is time for you to have a break. Oh, just kidding. So that's basically what it is. So we're gonna go on break. So it is 7:06. We're gonna come back at 7:40. Okay, 30 minutes break. 7:40 it is. See you later. Enjoy your break. Okay. See you later.
Okay, teachers.
Oh, you're welcome. Okay. So we are back from break. Let's continue with this chapter. Again, we're talking about the health medical records or electronic medical records, electronic health records. That's basically what it is. So we're talking about all these benefits or having, the information of the patients electronically. So it's very important. So we're gonna move on discrete data. Now, when we talk about discrete, that's part of the safety regulations that we have in the system. So anytime that we are like looking or searching for information, this information is coded. So can't just enter a place in the system and we're gonna find everything in there. Remember that each one of us in our profession are gonna have a login and a passcode that is going to allow us to enter the electronic medical records, but we are gonna have some limitations. Again, that's what's important. And whatever we're gonna do, whatever information we are looking over there, we're gonna have some notification right there that is gonna tell us whether we are entering a safe or unauthorized area or not. So we need to make sure that we definitely, follow our protocols. So that's basically what it is. So you can enter the place, you can retrieve some information, you can review some information only if you are permitted to do so. Other than that, it's not gonna happen. So again, be careful because that's part of the security system. When we have paper-based medical records, we didn't have that. So that means that, if something happens, if you pick up a paper, lose results or something like that, give it to someone else, probably if it didn't have consequences, didn't have any problems with the results, somebody did something about it, well, you would not get in trouble. If the paper medical record got lost or something like that, probably you did not get in trouble. But electronic formats, you're gonna have trouble. Remember, you're gonna be we're gonna be monitored all the time. So be careful with the information that we're searching. Let's talk about these electronic health records, all these data that is computerized that we have different ways of comparing or looking for information to make sure that we have the right vocabulary to understand the codification of these systems, because each system uses a codes for you to get the right words. That's basically what it is. That's called the EHR nomenclature. So that's basically what it is. So we're going to have certain codes that we are going to use that are going to be representing these particular terms that we need to use. Remember, due to the fact that these medical terms, some of them are very similar. So we're going to have codes that are going to identify them. So that's basically what it is. So for instance, when we are going to bill the patients for services, we're not going to write down, okay, we spend 15 minutes with the patient, so pay us for 15 minutes. No, that's not how it works. We're going to have some codes that shows that this visit was for 15 minutes, for 30 minutes, for 45 minutes, for an hour. And it's going to show also the procedure. And the procedure is going to be a code. And this code is not going to be, oh, we did an EKG, we draw blood, we collect urine. This is an X-rays that we order. No. They're going to have codes because this system, every systematic computerized system works with codes, and though they only understand these codes. If I bill for patients that I did a colonoscopy and I write down, okay, I did a colonoscopy, the insurance is not going to pay me. The insurance is going to send me this back, says, oh, wrong code. Why? Because it's not someone who's reading it, it's a machine, it's a system that is programmed to understand codes, not names, not letters, but themselves. So if I diagnose you with diabetes, I'm not going to be writing diabetes. I'm going to be writing diabetes myself, but not to claim for reimbursement. I'm going to write diabetes and I'm going to send this to the billing and coding department, and the billing and coding department are the one in charge to change this diabetes for a code. This 15 minutes, 30 minutes, 45 minutes service, they're going to change it for a code. If I order a procedure, it's going to be particular code for that procedure. Everything has a different code because each code represents the amount of money that we're going to get reimbursed according to the patient's insurance. We don't get the reimbursed the same amount of money for all the insurances. Depends on the insurance that the patient has. Depends of the plan that they purchase, or whether it is government insurance. They're going to pay different amounts for different services, different procedures. But all this has to be coded. So that's basically what it is. So for clinical terms or medical vocabulary, we're going to have a special software application that is integrated with the medical records. Why? Because these words, these medical terms, where are they going to come from? We're not going to go to online to Google it. That's not how it works. It is the system itself. It's like the system itself has these nomenclature for medications, alerts, contraindications, side effects, levels of toxicity according to the dosage. It is special software application. This is not something that we just enter the information on the internet, online, and Google, and immediately we're going to get the answer. That doesn't work that way. That's not reliable. 100 sources are going to respond to it. You have used Google, haven't you? And when you use Google and you enter something, let's say medical systems programs, oops, they're going to come all these schools that teaches medical system program. They're going to talk about the schools. They're going to talk about the program itself. That's going to explain what it is. And different sources, different organization that offers the program. That's not what you want. You want a precise code, a precise medication, a precise word that you need. That's what you need. And that's what we use this particular built, customized medical vocabulary that is going to be used just for that purpose, not for anything else. So that's basically what it is. So anytime that we're writing something, we're going to get the correct spelling. The word is going to be right there. This is like when we type in something. But if you type something that the system doesn't recognize, you're not going to be able to add that letter. So you have to use the spelling by looking for the particular word. That's going to take too much time. Here, the system is going to tell me. If I'm going to be typing sphygmomagnometer and I don't know how to spell it out, well, the system helped me out because it is built in the system, this medical vocabulary. So I can add it for anything. I can add medications, lab tests, all these medications that are so difficult. not only to pronounce, but to spell out. And we don't want to make mistakes because some of the words, some of the terms, some of these medications and conditions, they sound alike and they look alike, but they are not. They have a little something that is different, which means totally a different condition, totally different medication. So that is basically what it is. So when I'm evaluating my patient, I just start entering information. If I don't have that information already in the menu that I can just select, then I have to add something. If I add something, I'm going to have the appropriate nomenclature, the appropriate terms that I can use for that. Just because you're a medical doctor does not imply that we're going to know every single spelling of every single medical vocabulary. That is impossible. That's not going to happen. Sometimes we encounter medical terms or medical conditions or symptoms that probably we never heard about it. Now we have to look for the appropriate word and code, because if I don't give you the appropriate spelling, the correct spelling, how are you gonna get the code? That's gonna be impossible. So that's basically what it is. So that will be, all these new software, applications that are add-ons to the system. That's what the systems are expensive. Because you have to add all these ancillary, software applications to have a complete medical records. And they sell it separate. This is like the features for your home. You want a home that comes with all the furniture, it's going to cost you more. You want your car to come with leather seats and with a huge navigation system with Bluetooth and all the stuff. Well, guess what? You're going to pay more. So that's basically what it is. These are customized, but we have to have it because it's very important, because we can prevent errors. That's why everything that is done computers is going to have less margin for errors. So that means more accuracy when we're treating the patients, less lawsuits, if you will. There's a lot of things that this system is going to tell us. And if there is something, that the other providers have been using for this particular medication, they're going to recommend this first as a gold standard. Something that is used more frequently for most of the medical doctors, they're going to let us know if there is a condition that meets most of these symptoms, all these signs, based on the patient's medical history. They're going to give us certain diagnosis that is going to be a lot easier for us to narrow down and rule in or out diagnoses. So that's the beauty of electronic records. That would not happen in a million years with paper-based medical records. That's not going to happen. Or you know, or you don't know, or you have to do your research separate, and then use two sources. Read the book, go on the system, and have this system separate from the medical records and then the electronic medical records, and then you have to do your own search. Now you have to add from there here and read right here and copy right here. That's going to take a lot of time. And you're definitely going to make mistakes because you have to go over a lot of stuff in order to kind of narrow down what you actually need. So all these systems have that. So when we talk about electronic health records or electronic medical records, see, we just think, oh, well, it's just that, it's electronic. Yeah, we can share this information, but we don't know all these intricacies that these software applications are built on. It's very complex, has lots of things. And that's what you have to understand. That is not just simple. It's not like Word. or PowerPoint presentations. Straightforward. Yeah, you need to learn a little bit here and there, and they have most of the tools needed to build a presentation, but this is a different issue. This is our patient's health. These are medications that can cause damage instead of, fixing the problem. And it's not only us that we're going to be using this information. This information is going to be used for other providers that are involved in the patient care. And if we got the wrong information, then everybody's going to get the wrong information and the wrong diagnosis. And the patient's not going to get better. So again, it's very important for us to understand that. Capturing and recording electronic health records data. Now, when we said capturing is everything that we gather from our patients or from other sources that are, related to the condition of the patient's care. So that's basically what it is. So all that can be, sent to the medical records from the patient from different sources. That's something that we discussed already, like lab tests and results. We can order something and then we need to know the results. Now that information is going to be shared both ways. I'm placing an order for this particular test, this particular medication. Now I need to know the results after this body fluids have been sent to the laboratory. Now remember, there is an interface, there is an interoperability, there is a compatibility. All these are different terms that are used for this purpose of getting all this data from one location to the next based on what software application you have. That is called interoperability. Remember, if I have a system and the other hospital that are receiving the information have a system, it doesn't have to say in the same brand, but it has this compatibility applications. Now they can send information and I can open the information if my system is compatible with that system. Interface is done, emerge all this information, all this data, it doesn't matter if it is as a form of video, pictures, films, or just text. All that information is going to merge within the patient's medical record. It's not sent to a different part of my computer. I have to get it and I have to place it back in the medical records. No, because the person that is sending the results have the patient's information. And that patient information is linked to their system, to our system, so it can merge that information right there. Place it right there on that particular. If it is a blood test, it's going to go with blood tests are. If it is an imaging report, it's going to be where imaging reports are, but it classifies whether it's an X-ray, CAT scan, MRI, sonogram, anything. So that's basically what that's what facilitates everything. We talk about the transcription to word processing files, what are important. So I receive the official reading from a radiologist. They just type it. Oh, the patient has this, blah, blah, blah. You recommend you to do this. That information is sent directly to the patient's medical record alongside the image of the X-ray, the CAT scan, or any laboratory, or the results. So the laboratory person there, if it is a chemist, if it is a microbiologist, if it is a pathologist, if it is the radiologist, they're going to analyze the results. They're going to give me the results now that I can read, that I can understand. with comparables, what's considered normal ranges, what's considered above normal ranges, below normal ranges. So we're going to read it. So all that information is going to be merged from this facility, external facility, or internal facility to our system. Not only that, the patients can, add information, make corrections. So that's basically how it works. So it's very, very important that we understand how the system is integrated with all these applications. But if it doesn't have all these applications, all this software, comparable equipment, then we're not going to have access to this information. So we have to have it if we're going to receive all this. We talk about this, the radiology studies. Remember, all these digital images are directed and merged just like labs, and any other type of data can be added to the medical records. So that is basically what it is. It's very, very simple, makes things a lot easier. No more papers, no more loose papers, no more missing charts. All the information is going to be there, our fingertips. Very simple. If you do vital signs in your laboratory when you register your patient, that immediately is going to go to the medical records, and the medical records is going to be opened by the medical doctor, by the nurse, whoever wants to see this information, whoever have access, or whoever is, in the care of the patient on that particular day, or any other day for that matter. We're going to go and review it. So almost everything that we collect from our patients and is entered, is captured and entered in the system, is going to be available for all the medical providers that have access to these electronic health records. So that's basically what it is. We talk about health history, symptoms, signs, evaluations, prescriptions, everything. See, something new right here. Well, it's not as new. I mentioned it before, but we're going to go mention it again. But we have not mentioned this much, which is the prescriptions. Remember, we have an electronic system that is compatible with pharmacies. So we're going to be able to exchange this information. We send the electronic order for the prescription to the pharmacy. This pharmacy receives a notification that, someone sent you already prescription, and then start working on it. But the pharmacy uses this data nomenclature to make sure that they actually verify whether the patient have any allergies to these medications based on the medication that this patient had received. There's any contraindications, any side effects that the patient needs to know about it, whether the dose of the medication is too high, too low. It's not that the pharmacy receives the prescription from the medical doctor and they're gonna take it as prescribed. No, if there is something, there is any discrepancies between the order and the medical doctor based on the findings that I have when I receive this prescription order, then the pharmacist is gonna contact the medical doctor that placed the order. The pharmacy has no rights to change the medication by themselves. That is not how it works. Now, if the medication is not covered by the insurance of the patient, now the pharmacist or whoever receives the orders have to contact the medical doctor, who is the prescribing doctor, and tell them what is the issue. Whether the medication has any issues with other medications, any contraindications, bad side effects, any interference with other medications. So The medical doctor got to make a decision, says, oh, wait a minute. So let's see what other medications we have. Well, the pharmacy can help them out, says, hey, we have this medication. It works for the same condition, but it doesn't have this many side effects and it's not contraindicated, doesn't have the side effects that this medication is having, so, or less side effects. But the pharmacist needs to talk to the medical doctor. This is not like, oh, I send you an order and you just fill it in. That's not how it works. Remember, the pharmacy can get sued as well because you're a pharmacist. You should know more than the medical doctor. I know this medication works for this. But you as a pharmacist, you know what are all the ingredients, all the components that the medication has. So if you see something because you have all the information of the patient there too, and it's computerized, so you're gonna have these alerts as well. So we work kind of together. It's a part of the team for the good of the patient. That's how it works. If a medication is scheduled to, then they're gonna verify with the medical doctor. Refills that are not supposed to have a refill because the test has to be ordered before refills needs to be given to the patient, they're gonna contact, they're not gonna give it to the patient. So whatever, again, discrepancies they have, they are not agreeing with something, this is not right, doesn't look good, they contact the medical doctor. Remember, just for you to know, because this can happen to you, if the pharmacy tell you that your insurance does not cover the medication, some of the doctors, they do not know. I do not know what medications is covered by your insurance, which ones are not. That I'm definitely I don't. But I do know that trade medications, brand medications, most of the time are not covered for certain insurances. So we have to get a generic medication. That's something that the pharmacy does. It's the same medication, but it's not brand. It is generic. During pharmacology, we are going to talk about this. We're going to have a class about medications. So we will discuss what's the difference between, brand and generic medications. Why? Why is it one cheaper than the other? Is it true that these medications are not good, or this is different? Well, we will discuss that because it's a lot of information about that, but this is not the chapter. But it's just giving you an idea what the pharmacy does when we have these interoperability systems or interface systems that we use to facilitate errors, to facilitate that the patient do not receive the medication because the patient received the prescription pad. They go home, they don't go to the pharmacy, they forgot, or they left the prescription pad in the pharmacy. They don't have the medication available. They don't have time to wait for the medication to be released. Then they don't come back. They don't take the medication on time. So it is, a lot of things that, can happen if we do not have these electronic systems. So for the safety of the patient in many ways. Remember eligibility. I understand exactly what this medication is because I can read it. It is type versus the doctor's kind of signature there. Very difficult to understand. It's not legible to products. So the doctor again orders through these systems and prescription. The pharmacists cannot change things on their own. They cannot make decisions. Oh, the insurance doesn't pay, so I'm going to change it for this one. That happens in our countries, not here. Here things are more organized and they are serious. But yet The pharmacy is going to call the medical doctor. It's going to tell, hey, your patient is not, the insurance that your patients do not receive, do not pay for these medications. So instead, you can use the generic one. So then agree because you have to get the medication. That's the insurance that you have, and we don't want you to pay for it unless you want to pay for the brand medications, which are really expensive. So the issue here is how we, interface all this information from the medical provider to the pharmacy, to the medical provider, to another medical services that we need to refer our patient to for any reasons, whether to get a imaging exam or a lab test or a referral or a procedure. So we have all this information right here. So we can share that information and we can receive immediately what is being done. I can see from my end whether the prescription was released, whether the prescription was picked up by the patient. I can see everything. Why? Because the pharmacy is going to send me the information. I'm not going to be there waiting for it. This is like your messages in your phone. You send a message, then they answer you back. Sometimes they don't answer you back immediately. Or you're not reading your message immediately, unless you're waiting for something desperately. But other than that, no, you see it when you see it. The same happens to the medical doctor. It's not that I'm seeing there, okay, I prescribe medication. I'm going to wait here until I see if the medication went through, if they, deliver the medication. The patient pick it up. Now, it's not my problem if the patient doesn't take the medication, but I know that the patient received them. No, that's not what we do. We just have all the information over there. So when I review the patient's information, I say, oh, patient, I prescribed this medication was picked up. Now let's see how the patient is doing. That's how we do it. So it's very important for us to capture all this information. Now we know all this as well. Remember, this is kind of, overlapping information. The nurse, the medical assistant, anyone who works, who are taking care of that patient and collects data from this patient or collects information and enters in the system, well, you're going to have access to it. So everyone who is involved, this is not just the nurses, the medical assistant, it's everyone who works in that particular office. Now, patient can enter information. Remember, patient can change some of the information, personal information. Patient cannot change the medications that I have to describe. Patient cannot add or remove things. No, they can add medication that someone else is prescribing them, or if they are taking over-the-counter medication. By the way, I have this little cold that I think that it was a cold, so I took Tylenol, these many milligrams, these many times per day, or for this period of time. That's what's important. They're not gonna do all that exactly like that, but it says, oh, have you taken any medications because sometimes we enter the system and they might ask you if something have changed, if you have taken anything, you have become sick or anything, and you enter some information there. Or at least just to make an appointment or to request for your lab results. So that's basically how it works. So we always, enter information or gather information, reviewing the information that we have there, but we have access to it. Or it's the medical provider who's doing that. Remember, anyone, including the patient, can enter information, add information, or ask the medical provider to remove information if they believe that information is inaccurate. Oh, the patient turns out that a diagnosis or a procedure that they never receive is being added, or they're not sure about what it is. They can, consult with the medical provider. They're not going to be able to remove that information. Because remember, information that is entered by the medical providers, you're not going to be able to, they are inactive, they are read only. So you can add, you can create an addendum, which is an add-on, it's like adding a little message or a little correction. So you can add right there, well, correction, I'm not taking these medications. I have never taken this medication. The medication that I actually taking is this one. I never been diagnosed with that condition as far as I know. Then they're gonna evaluate to see whether there were any errors over there, and then do the pertaining corrections. So that's basically how it is. Remember, the patient have access to some information on the patient's portal, but or a patient's health record, but they can add certain things, but they cannot remove what was there before. This is just like any medical provider. You can create an addendum, but you cannot add what was there before, because we need to know why this add-on is there. Why is this correction made for? So that's basically how it works. So I hope you kind of understand what's going on with this. It's not like, oh no, I'm the medical. Remember, we as patients, because I have like, my patients' medical record, have access to my personal health medical records. So when I enter there, I changed my phone number twice this year. So I was out of the country, so I need to change my phone number. I went away for a long time. I was there for over a year. So I'm not gonna pay for services right here for a year for services that I'm not using. So I didn't even tell my carrier that, listen, I'm gonna be leaving, so can you save my number? I just totally forgot. So after the month that I didn't pay, then immediately, well, they canceled my services. I believe they did. I came back and then I have different numbers. Well, I went to my personal health record and I changed that. If I have something else that have happened when I was overseas, I have to document it there. Let's say some medical condition that I have developed over there. See, I'm in a tropical country. I'm, prone at the risk to develop malaria. I don't know if chikungunya is there, but malaria, very common. So if I have that, then I have to report it here so I can be treated here. So they know that I have that. They know that I took some medications or not. So that's important because it's important for my health. Remember, we have to be very honest with our medical providers, because if they know that I was exposed to this particular infection, they needed to know. If they don't know, and this complicates or something is dormant inside my system, and then I don't say anything and I have an outbreak here with that condition, they're not going to be able to help me. Probably they're not going to be able to save me, because I didn't tell them anything then. Otherwise, they would be prepared and they said, oh no, you had come from an evaluation, we're going to give you this or that. See how important it is that we have to be honest with our providers, because anything that we have in the past or we currently have, we need to tell our medical doctor so they can keep on track what's going on with us. Other than that, it's not going to happen. And we have our personal health records that we can enter some information without coming to the office. It's just when they see it that we add some information. Remember, every single time that we do some changes, we add something to our personal health records, they're going to receive a notification. Just like that. It's like when you have a email pending. I see right there a notification, a text message, a voicemail. A missing call. Everything is going to be there. So again, it's no different from the medical records. And that's how we're going to keep on track whatever is going on. Remember, this couldn't be possible when we have paper-based medical record. But this data is as good as the people that captures them and enter this information, how they record it, how accurate they are. Because if you are entering inaccurate information, what do you expect? So it is as good as the person who entered this data. So that's basically how it is. If I don't collect good data, if I'm not adding what is needed, if it's not complete, so then it's actually not good. So this is how we have, the medical records, this instant message, history. Sometimes you enter your offices, hospitals, these, good hospitals, particularly private hospitals. They have a computer right there in the waiting area by, the front desk. So when you go there, you sign in the computer, just like other public buildings. You go enter your name, your information, and you get this. See, in this country, I haven't seen that when I go to the bank. When I go to the bank, I have to go see a teller. Or actually, I have to sign a paper if I want to see someone, except, talking to the tellers. In my country, we have right there in the waiting area, as soon as you arrive, the security guard, directs you to the system. And you have to go there, enter your information, and what is the reason that you're there. So then this particular department in the bank is going to take care of you. They're very organized. Unfortunately, we don't have that here. But some of the hospitals, they do have a tablet or a laptop, just on the screen right there when you go there and you register. When you go there and answer some questions, your registration form, if it is the first time, or if you need to update your information, you can have access to it. It is for all the patients. So that's how good it is. So they're going to ask you a bunch of questions if you have or had, and you just answer yes or no, yes or no. Very simple. So that facilitates and give us time, we, the professionals who are there, not to take too much of our time to address this situation that can, electronically can be fixed. That's what I told you the story about, what we do in most of the public buildings. But when you go to the bank, that's what it happens. And you know how long it takes me for taking, well, depends on the bank that I go to. It takes a few minutes. In 5 minutes, somebody's calling me. Some places you have to pick a number. We have that here, like when you go to DMV, so motor vehicles department, or other institutions. Well, hospitals needs to be a little more organized, but now they're getting into the trend of having the systems in place. So when you go there, you register, you get, and for the safety of the patient, and it keeps organized. Because here we're really going to see who was first, because it's going to show on the system. So that's what's good. Here we have a summary screen, about patients, all the questionings that we gave them. If they said, so we're going to see all the information that the patient entered. So if we have some questions, or the patient probably leave this blank, one of the answers that we have another question. It says yes, the other one they say no, but it has to do, it's very related. So we're going to clarify to the patient because that's our job. When we see something that kind of conflicts with other information, we got to make sure that we got the right information. I'm not talking about you as a medical assistant. It might be the doctor when they, interact with them in the exam room or the office where the doctor is at. So we're going to have everything, and it's clear and it's legible. The patient can read it, we can read it, anybody can read it. And we enter this information. There is always these particular options that you're going to enter. You're going to say, save the information. We can refresh the information. Oh, there are 2 patients right here, but I can see only the information of 1 patient in separate pages. Oh, refresh that. Then the next window is going to pop up with the other patient's information, and so on and so forth. So we have all these features just like our phones. These are computers. So we're going to get all the information right there. So what are the features of these EHR systems? List. So we're going to see the list of the patients who were scheduled for that particular time, whether just a regular visit, whether it is a procedure, or whatever other situation, a test. So we're going to have a list. Oh, this patient is here for this. This patient is here for this or that. We're going to have all these forms within the system. So whenever we need a form, we just click on it. We go to the section of the medical record, and we can have some of the times to add, like when you work in a PowerPoint presentation, or just like when you're doing, Word. The first page is filled, then it moves to the second page, and so on and so forth. So you don't have to be adding something. Oh, I don't know when I'm going to put more information. My first page is I run out of space. So what I'm going to do? No, just keep on typing because the next page is just going to appear over there. See, sometimes we don't even pay attention to that. When we're writing down on paper, well, we finish this page. This sheet of paper is completed. Now we need to add another one, and we have to pick it up if we don't have it. Here it's not. It's automatically generated. But we don't time sometimes because we are so used to, we don't pay attention to it. When I created this PowerPoint presentation, well, the ones that I create, or I just edit. But if I have to create one, I have to add the next slide, the next slide. I can duplicate then, I can do a lot of things, I can remove. But again, it is a system and you have to get familiar with the system. So we have lots of forms, and all these forms are the forms that we need to add to the medical record, like progress notes. We can have plenty of progress notes. Anything that we need there is going to be there. We just need to click, find it, select it, add it. That's how it works. Because the pages are not going to be there. This is not like an open, like a new notebook. Oh, I just got this new notebook, so I have all these pages blank, so I'm going to fill them up. I'm going to complete. It doesn't work that way. It just uses the page, and when the other page is needed, automatically it shows up if it is set up that way, or you click, you go to search, and then you look for the form, and the form is added to that particular section where you are when you need it. That's how it works. Now remember, we have this search window. just like Google, like YouTube. Any software application that we use, it have a search button or window. We're gonna go there and then we're gonna type what we need. That's basically what it is. And because we have these very important data nomenclature, so if we would type something that we're not familiar with, well, we're gonna get some options right there. The system is gonna generate the word that you're probably trying to look for. And as many words as you use, more concrete answers you're gonna get. So that's basically what it is. We don't have a search window in paper. So again, yes, we can have a list of things right there, but this list is not something that we're gonna look for. It has to be added. Somebody has to type it or write it down. Here, the information was entered in the system. I just need to request it. Then I get it. So I'm going to the system and said, oh, medications. Medications that my patient is taking. All the medications are going to come in an order that it was prescribed, the dosage, how often the medication is supposed to be taken. If I need a progress note, I said just type progress notes, and then the progress note shows up. Or if the system is set up, then as soon as the notes for my progress note is over and I move to my next visit, well, a new progress note is going to show up right there. So that's basically what it is. You go to one of these, you go to the search or just the ribbon on top of your system, and you just select what you need. That's how it works. And the new progress note is right there. So just click on it. The progress note, the new progress note is going to be entered. Very simple. So again, this is so important. We're gonna have flow sheets. Remember that we can get all these graphics in our system if that's what we need. Now, just for you to know. So again, we're gonna have a bunch of things that are related to whatever we're looking for. So we select from there. That's called a prompt. So prompts are all these. You kind of type something and then immediately something that is related to what we're looking for, we just get it. So we entered values and we want to see a flow chart with that. We're going to have a flow chart. So we're going to have a graphic that is going to show us whether something is increasing, decreasing, or it is maintained stable, whether they are with normal ranges, above or below, or they are normal. So we're going to have that. That's what the medical providers. Electronic ordering, we know already that all these electronic forms where we enter the information, they're going to be in particular order. So we don't have to be changing the time of the computer. So we set up the system in such a way that when the sun or when the time changes, it's going to do the changes automatically, just like our cellular phones. So it's not like in paper, oh, today is this day, this month, this year, we have to write it down. Here, there's no, need for that. And I cannot argue that I saw these patients at 8:30 in the morning when the system said that it was 8:40 or 9 in the morning. So it's automatically going to date it, to order the documents. That's basically what it is. So it has all these bunch of protocols for, tests, treatments, any plan that I have, recommended for my patients according to whatever diagnosis they have. So we have protocols for that. It is like recommendations. Whether this test is better or is safer than this particular test, this particular medication, this particular procedure. We have to offer everything to the patient, but we're going to tell them the benefits and the risk, remember. And we go because we have to outweigh them. If the benefits outweighs the risk, then we go for it. But we have to explain to the patient what the consequences are, or doing, taking, or not doing, or taking this procedure, these medications. Remember, it's up to the patients. Sometimes we might think that, these medications help you a lot. It's better than this medication, but this medication has side effects. This medication is going to make you vomit. This medication is going to give you diarrhea. This medication is going to give you this itching sensation. So it's not going to be forever, but until the medication kind of sets into your system. But in the meantime, you're going to be feeling like this. Or this medication is not as good as this one with the problems, relieving your condition, but it's not going to have these side effects. Which ones do you want? So we're going to have all these protocols, remember, and we have to offer it to our patients. We can't just think something that we think that is good for the patient. No, patient needs to know all the options. Sometimes we don't discuss exactly this medication with the patient unless there is something critical with it. So when it's something critical, usually we don't go by that. We offer the medication. That is not, as critical as this one. Because I'm trying to improve your health, not to give you something else. Because that something else might stop you from taking the medication. We have patients calling into the office when, the side effects were not explained, and they start taking the medications, they develop nausea, they develop vomiting. As soon as this happens, they stop taking the medication, but they do not contact the office. You can't just stop taking the medication. If for any reason, you stop taking your medication, you have to inform us immediately so we can replace the medication. Or we can tell you that this medication is going to give you these side effects for a couple of days, but then the medication is going to settle and you're not going to be having these symptoms anymore. But you can't just stop the medication. But if we're not talking to you, we're not explaining you the side effects, chances are I would stop taking the medication if it made me vomit or give me diarrhea or something else that, it is very uncomfortable to stay. Communication, communication, communication. But this is what we're going to have with electronic medical records, because we're going to kind of find out in advance some of the things that might happen, because we have precedents, we have a history from other patients, so to speak. Point of care documentation. When we talk about point of care documentation, it's the place where the patient comes in and we offer the assistance. That's basically what it is. So point of care is like I'm recording the information right now where my patient is receiving the information. Because remember, we can receive information from other doctors, from other medical institutions. That's not point of care. It's point of care for them, not for us. I received the laboratory results. This is not the point of care. We didn't analyze these blood results. We didn't take your x-rays, CAT scans, or MRIs. We got this information from the source that we sent you over there. Still, all this information is gonna be entered in the patient's history, medical history, using the SoapNote. Remember, we're gonna do this all the time. Every information that we do collect here, we're gonna use the SoapNote, and any ancillary tests that are needed to diagnose, evaluations to diagnose, procedures to diagnose, and treat our patients is gonna be here. Now, remember, this is in an outpatient setting, but if we have the patients in an inpatient, or the patient is hospitalized, now we're gonna add all the treatments, all the things that the patient receive during the stay, plus the discharge papers. All that information, documentation is gonna be in the patient's medical record. So a lot of stuff, huh? Now, collecting all this information directly on the point of care, remember, point of care is where the patient, interacts directly with a medical doctor, not the information that received from someone else. Now, if I collect information and I'm getting all the information in the system, I'm gonna be able to complete all that information by the time that the patient leaves my office. I'm gonna be able to sign the notes. You know why? Because the system is programmed like that. As soon as you try to save the information, the medical information, the system is not gonna allow you to close to save the information until you sign the notes. As opposed to paper-based medical records. Paper-based medical record, the medical record just wrote something information there and then leave the paper over there and you can sign it at any time. Here with electronics, you are forced to complete it. Why? Because I'm not gonna be able to close this document, to save the document without the medical doctor's signature. So that is a great tool feature that this electronic health record has. Why? Because the medical record has to be signed prior to save it. So you're gonna save it because you're not gonna keep this window open with your patient when 5 minutes later you're gonna have another patient. So you're gonna close that one first. So you're gonna save it, because otherwise you're gonna lose all the information. But because you're not gonna be able to save it before you sign it, you have to complete it. Now you sign. Again, if it is incomplete, you're not gonna be able to save it, even though if you sign it. This is like some forms that you fill out, and it has a little star to the side or to the end of the item. That means that it must be completed. There are some forms that you cannot move to the second window to type information if you have not completed the information prior to that. So that's the same kind of fashion way of preventing, these medical doctors for not completing the medical records, or the nurses. Because remember, the nurses also have the nurses note. So that's very important, because an incomplete record is not going to be able to be used. Why? Because you have not saved that information. You do not have the diagnosis. Do you not have the services? So billing department cannot use it. You do not have the order for the medication. Nurses cannot use it. For the referral, you're supposed to give a referral to the patient. But because you have not closed, you have not completed your medical records, I don't know. The medical records is incomplete. I don't know where you're going to send the patient. Because the medical record is going to be able to be released for the new information. Remember, that information has to be updated. I can see the information from my patient at any time, but I don't see the information that you already entering. Why? Because you haven't saved it. Because you haven't completed. So I'm not able to do my job until you complete it, save that information. I can see anything else. But if I want to move ahead, like billing department, usually they are moving alongside with visits. Oh, they seen this patient right now. So I'm looking at the patient, I'm working on the patient that you have completed. Now I'm waiting for the other one. I can see everything else, but I cannot see the latest entrance because you have not saved it and completed. So I'm not going to be able to use it. But I want to do it because I want to complete the job from this patient. So that's basically what it is. So it's very important for us to understand how this system works. Electronic signature. Remember that we have to sign the documents, but you don't have to go there with an electronic pen or do it with your finger. No, usually we create an electronic signature. Now, your electronic signature might be something that it is eligible to know, or you just type your name, but you save it as such. So usually we sign because your signature is very difficult, to alter for someone to, forge. Versus your name is there. I can type your name in the computer and then get access to it, or do something. No, it doesn't work that way. So that's basically what it is. So we have a special process to do that. So the criteria for a valid electronic signature, because not every single signature is going to be valid. Remember, you have to meet these criteria. Message integrity. This is about what you are entering. So the information that you enter has to be accurate, has to be completed, and it has to be signed by the person that entered the information. It's not that you're going to be correcting something that is illegal. Well, you're not going to do that. Or somebody else signing on behalf of somebody else, or correcting and completing something. Should not. That the data and author identity are verifiable. That's another thing. Remember that your electronic signature is on file. So if somebody try to use a different signature or try to force the signature, it's not going to go through. So that's basically what it is. That has to do also with the authentication. Authentication means, these are the three criteria: integrity, non-reputation, or non-repudiation, and authentication. Remember, you're going to have a login, password, and an ID and a password. So you're going to be able to enter in that file and start, documenting or doing changes or whatever else, so evaluating or reviewing the information. So if you don't have all these three, this electronic signature is not going to be valid. Well, you're not going to be able to sign it anyways because you have to meet all these criteria. First, you're going to log in and you're going to be allowed with that login to enter certain areas. Otherwise, you're going to have limitations. So it's not that I have an electronic signature, that's it, I can use it. No, it has to meet all these criteria. I mean, that depends on the person who's entering the information, right? It has to be legal, not someone else doing it for you. Electronic signatures, we talk about this. Authentication. So your organization has to, have all these policies regarding, all these electronic signatures. So you got to be familiar with them. Again, has to do with a login and a passcode that you've been given by the administrator from, the IT department. So that's basically what it is. You cannot create yours. We talk about that. Okay, so let's see if we get something from this class. So this has a pretest, true and false. Now, remember, it's a pretest that was supposed to be at the beginning. I'm not gonna be asking my students at the beginning something because you're not gonna understand that. We haven't covered many things. So it's better to review first the material and then try to question ourselves. Okay, do I get this? Do I get the answer for this or not? So that's basically what it is. So the question right here is, the HIPAA security rule establish protection for all PHI stored in electronic form. The answer is true or false. So you know the answer because you know what is HIPAA security rule, particularly in electronic medical records. You know what PHI stands for, protected health information. So who protects patients' health information? HIPAA. And what part of HIPAA? The security rule. Because this is information, this data is in electronic form. So the answer, of course, it is true. So remember this takeaway tips that I'm giving you. Don't forget about them when you're taking exams. When you hear about HIPAA, because you are going to hear about HIPAA in your workplace, during your exam, all the time. So HIPAA, 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 Health Insurance Portability and Accountability Act. Remember that is different that I ask you what HIPAA stands for, which is what I just spelled out for you, whether what is HIPAA for, what HIPAA does. That's a different issue. HIPAA protects the information. That's what's called protected health information. Privacy, confidentiality, security of all the information of the patient stored in the medical records, electronic medical records. Security is only for electronic files. Security doesn't have to do with paper-based. Privacy and confidentiality has to do with paper-based and with electronic. Security was added for the purpose of keep the information secure. That is basically what it is. So the answer is true, HIPAA. So anytime that you hear about HIPAA, think about privacy, confidentiality, and security when relates to the patient's health information. That is the key. Has to do. What is privacy? Well, you should not share your passwords with anyone. That's a violation of HIPAA. This password was given to you to protect you and the patient's information. That's basically how it is. So anytime that you have, if you give information to the family of the patient about medical condition, you're violating HIPAA. You're disclosing this information. This is not privacy. That's called confidentiality. So you see how each one of these statements applies for one of these particular HIPAA rules. There is privacy rule, there is security rule, and confidentiality rule. So whenever you see questions related to confidentiality, privacy, security, you know already. The medical record was left on top of a desk, on top of the counter in the waiting area, where people can see it. You're violating the patient's privacy. That's not security. That is not confidentiality. Confidentiality is releasing the information without the patient's approval. Privacy is that you leave things when someone else can see it, because it's supposed to be private. Not keeping the curtains closed when the patient is changing, when the patient is laying down in a exam room. Every time that we deal with the patient, we close the door, we close the curtains. You don't ask the patient to remove things that are not necessary for the procedure. You're violating the patient's privacy, dignity by exposing the patient. That's how it works. That's the things that you have to look when you're taking a test. And that's exactly what you're going to have because I'm giving you all the tips for this. So this is through HIPAA, security, privacy, confidentiality. But you need to know when is privacy applies, where security applies, and when confidentiality applies. Because it sounds like privacy, confidentiality, and security all means this. No, they are not. It is a different thing. Otherwise, we didn't have different terms for it. My name, my first name, my middle name, my last name, my second last name. Yes, they identify me, but they are not the same. My first name is from my father's side. My second last name is from my mother's side. My first name is a name that they call me first because this is the first that I have. The middle initial, you can have a middle initial. You're not going to call me, oh, Mr. M, Mr. A. No. So each one of these terms means something. So yes, it is related to me or to you, but each one has a different definition. For that reason, we have these three different rules. So think about it. Second, pretest question. A provider can use an EHR system to find out if a patient cholesterol levels have increased significantly over a certain period of time. What do you think? True or false? I know you know the answer. It is true because that's the reason that we have electronic health records or any type of records, but we're talking about electronic. If we document the patient's information and we have the values, the comparable values, which is what's considered normal, what's considered abnormal, high, low, well, we know. And that's how we keep the continuity of care from our patients. What is the purpose of getting lab results if we're not going to keep this, in the patient's file? So every labs, every results, we're going to figure it out based on our comparables, depends of the lab that is running this test, but they gave us some ranges in which is considered, normal, above, below normal. So it is true, we know that. Number 3, the abbreviation XR stands for therapy or prescription. Well, it is one of the other, it's not the same. Stands for therapy or means either or. Prescriptions. Well, RX, if you remember your prescriptions or your medications or just the signs on the pharmacy, they have RX. So that means prescription, not therapy. It's a different issue. Now, when we said therapy, that will be treatment. And treatment is not RX. Treatment is TX. This is treatment. This is, because therapy is treatment, remember. RX is prescription. So don't forget about this. So there are simple things that, that you gotta be familiar with. That's it. So this is the workflow in the office or medical department, medical records department, who gets the information, where it moves the information to, who uses it, and so on and so forth. So that's basically how it works. Okay. Any questions?
I want to know the last question is true? is afraid.
Okay, remember we have two possible answers. So it is true. It says the abbreviation RX stands for therapy or prescription. So it is prescription because the option therapy is not applicable. RX stands for prescription, not therapy. Therapy is TX. That's a different, way of expressing this. So RX is prescription, remember. Any other questions?
Thank you.
You're welcome. Remember, sometimes it might be simple for some of you, for some of us it's not. I have to learn this too myself a long time ago. And trying to get this straight is not easy. So whenever you have a doubt, I'm here to clear it up for you. And if I don't have the answer, believe me, I will not give you the wrong answer. I will try to look for the right answer and, give you the appropriate and correct answer. Any other questions before we call it the night or we close? Okay, so thank you again for attending the class, for participating. Oh my God, I'm so happy that I have so many people. Lately, most of the people's participated. This is good. Remember, when you listen to the lectures, you kind of, it's different reading the information. Probably watching the video helped also.